Assalamualaikum warahmatullahi wabarakatuh. We from group 1. Before that, good morning everyone. From group 1, we can discuss about the fish tank Granuloma. We introduce my group. Number 1 is Habibah Yulia. Number 2 is Dhea Istiva. Number 3 is Farras Azizah. And number 4 is Sukma Anandyaguna. Next. The discussion from the group is an introduction to risk factor, 3 transmission. Number 4 is food symptom. Number 5 is cash distribution. And number 6 is food safety and control. Next. The next we deliver from Habibah.
Okay, thank you, Sukma, for the time. The first one is introductions. Fish tank granuloma is a rare skin infection caused by Mycobacterium marinum, a non-tuberculosis Mycobacterium. The organism is found worldwide in stagnant freshwater and saltwater environments, including lakes, inadequately chlorinated swimming pools, and aquariums. Mycobacterium marinum is a slow-growing atypical mycobacterium that is commonly found in bodies or fresh or saltwater in many parts of the world. Skin infections with Mycobacterium marinum in humans are relatively uncommon and are usually acquired from contact with contents of aquariums or fish. Most infections occur following skin exposure to the bacteria through a small cut or skin scrape. This is the transmission. The terms fish tank granuloma and fish handler disease is often used due to the relations between home aquariums and the water-associated activities, including swimming, fishing, and boating. Human infections with Mycobacterium marinum under normal circumstances are rare. However, people who have minor breaks in the skin, such as small cuts or scrapes, are at increased. First one, when in contact with water from an aquarium or fish tank, and then when handling, cleaning, or processing fish, and then while swimming or working in fresh or salt water, and the last one is while standing in contaminated water. Who are people at risk? People at highest risk include home aquarium hobbyists, swimmers, aquarium workers, marine life handlers, anglers, and oyster workers. Overall, anyone with frequent or persistent saltwater or freshwater exposure is a potential risk. Here is a list of people that have risk to get this tank granuloma. The first one is personal home aquarium owners, and then professionals who clean aquariums, and then marine biologists, and then fishermen exposed to saltwater fish, and then immunocompromised patients. The next materials will present by Dhea.
And thank you, Habibah. Next, about the symptoms of fish tank granuloma. Typically, patient may initially notice a small red bump or non-healing red sore on their skin a few weeks after a history of exposure to non-chlorinated. The symptoms like slowly developing a nodule or raised bump, swelling of nearby limbs not occurs, getting a scratch, scrape, or puncture wound several weeks before while in water. Next. Some patients may feel no pain or itch, while others commonly have some localized pain and firmness at the site of the infection. Most otherwise healthy people overall feel well during the infection and don't have fever or chills. Patients in poor health or those with other health issues like an impaired immune system or other serious illnesses may experience fever, enlarged localized lymph nodes, and systemic infection. Next. The case distribution of fish tank granuloma, Mycobacterium marinum skin infection, the first detected at 1962 by Swift and Cohen, and well known in the United Kingdom. Infection of human with M. marinum after fishing, putting, and other exposure to salt and brackish water has also been described. And between 1993 and 1996, 653 cases were confirmed in the USA. And between 1996 and 1998, 63 cases in France was confirmed. Okay, next. Material will delivered by Farras Azizah.
Thank you, Dhea. The next is a case report from Sri Lanka. A 51-year-old patient presented in with a history of episodically discharging skin lesion over the right thumb from 10 years duration, which had recently started enlarging in size for 3-month duration. The diagnosis saw a case of Mycobacterium marinum infection, which started following a cut injury sustained while cleaning a fish tank. Next. The next is a case report in 2020. A 30-year-old white Caucasian man was referred because of a single well-demarcated plaque localized on third fingers on the left hand above proximal phalanx. Without subjective symptoms, he did not suffer from any chronic disease and did not take any medication. He was neither a smoker or neither alcoholic. The first lesions appeared about 3 years earlier in the form of several papules, which evolved into one gradually expanding plaque. He was treated with topical glucocorticoids and oral antibiotics for several months without any improvement. Particularly noteworthy in the interview is the fact that the patient was an ichthyologist who was working mainly with a fish species called African sharp-toothed catfish. Due to the fact that Mycobacterium marinum infection is uncommon, it is in case clinical of suspension, it is not necessary to perform skin biopsy, culture, and tissue PCR analysis. The result of the histopathological examination confirms the presence of granulomatous inflammation in about 15% of the cases and depends mainly on the duration of the disease. The first picture is the condition of the hand lesion before the treatment, and the second picture is lesion after treatment, 14 days with sulfamethoxazole and trimethoprim. Next. The next is food safety and control. First is disinfection of storage tanks and plumbing before the fish is processed into ready-to-eat food. Second is add ethanol, glycol, and sodium chloride to to crush Mycobacterium marinum. The third is add sodium hypochlorite as a strong sterilizing agent. And the last is the use of DNA vaccine AG85A. Next. The next material will be referred by Sukma Anandyaguna.
The next is solution. Control strategy and prevention strategy. Next. The control strategy is surgical debridement along with antimicrobial therapy is usually required for control. For order, surgical debridement should be limited to the case with the criteria known to be associated with a poor prognosis, including steroid injection into the lesion, a persistent drainage sinus tract after several months of antimicrobial therapy, and persistent pain. Most of the infection spread to deeper structure and treated with surgery, which seems reasonable for an infection limited to skin and soft tissues. There is no clear benefit of surgery, and surgical side effects are unknown. Other therapy, such as lithotherapy, X-ray therapy, and electrodesiccation, have been reported but have not been evaluated. Next. Next is prevention strategy. Number 1 is bandage or dress any open wound or cut before exposure. Number 2 is clean hands shortly before and after exposure to aquarium water and components. Hydrochloric solution may be used in test hand washing. Number 3 is do not swallow aquarium water when checking for salinity and siphoning water. Number 4 is do not overcrowd aquaria since they favor the multiplication of microbacteria. Number 5 is UV germicide lamp or treat aquarium water are efficient for microbacteria as long as they are used in clean condition at the correct flow rate. Number 6 is do not transfer tank filter or fishes in the bath that is used for human or carefully clean it with sodium hypochlorite. Number 7 is the exposure population should be educated in order to recognize signs of M. marinum disease in fishes and in humans so they can inform medical staff, a point that will expedite the diagnosis. Number 8 is fish salesperson should be educated. Indeed, many tropical fish salesperson ignore warning about fish tank granuloma. In France, although 20% of them are at risk of a marinum infection, 95% of them immerse their hands without gloves in the fish tank every day. The next. And this is the references from the group. Next. I think that's all from the group. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh. I give back to the Fahma.
Okay, thank you, Group 1, for your presentation today. And if there are no questions, I will close the discussion from Group 1 now. Is it okay? Okay, I will close now. Thank you for our group that has presentation today. I really appreciate all your hard work. Wassalamualaikum warahmatullahi wabarakatuh.